Welcome to the 7 Secrets That Obamacare and the Insurance Companies Don't Want You to Know training video. My name is Vince Curtis with Affordable Care Consultants, and for your benefit, I'm not an insurance agent. I'm a healthcare advocate for businesses and families with their healthcare needs, teaching them the secrets that Obamacare and the insurance companies don't want them to know about. 7 secrets that are so powerful that the individuals, families, and businesses which take the time to learn these proven methods are put in a very strong position financially, productive, and compensation-wise. This video and its secret strategies will forever change the way you see and implement healthcare from this day forward, whether or not the Affordable Care Act is ever repealed. And based on the recent Supreme Court ruling, it is becoming less and less likely that it will. This strategy works 100% of the time. In this video, you will learn how families and businesses have cut their premiums in half and actually gain coverage and security as a result. Just imagine what that would mean to your family or business. The only time it has ever failed anyone is when they didn't take the time to review and employ it. So who are we? Affordable Care Consultants are healthcare brokers with knowledge and strategies designed to specifically help save money and drive productivity by utilizing technology to provide everyone with efficient, immediate access to healthcare solutions and other personal services. Strategies that Obamacare and insurance don't want you to know about. In fact, there are 7 specific secrets they keep hidden from you, so powerful that the following companies literally spent millions of dollars preparing for Obamacare and found that the same solutions we provide are the best available. As a result, they all now save millions of dollars every year in premiums, deductibles, out-of-pocket, production, and rehiring, while providing far superior coverage for employees and individual families alike. These Fortune 500 companies all over the U.S. and many more are utilizing exactly what I'm about to share with you and have been using this successfully for years. Companies like AT&T, Metro PCS, the Home Depot, Pepsi, BMW, Wells Fargo, Penske, and even the Hospital Corporation of America. Every one of them all see this as the very best solution available. However, before we get to the 7 secrets and solution, it's important that you know a little about me and how I came about this life-changing information. For me, it all started in 1991 when my son was 6 months from birth and we knew he was going to be born without kidneys. Since his birth and to this day, he has undergone 67 surgeries, including 3 transplants and numerous complications in between, all while raising 6 daughters in the process. My family and I have experienced firsthand the domino effect throughout those years stemming from the pitfalls of hidden clauses within health insurance coverage. Hidden clauses and pitfalls that leave families extremely vulnerable and unprotected. Things like huge coinsurance charges, bankruptcy, overcharging by hospitals, the loss of work or not offered employment due to the burden that chronic care puts on group policies. I have known the fear of not having coverage for my 6 girls. I have seen families lose everything because of healthcare debt to the point that they can no longer even pay for the most basic healthcare. And I have seen the spouses blame each other and families torn apart when that happens. All these things and more that nobody ever even thinks about or imagines can hurt them until they face it, but by then it's too late. So when the Affordable Care Act was announced, I utilized my experience to see how well our government actually protected us and how affordable they actually made it. After reading the 1,000 plus pages and taking numerous courses on the Affordable Care Act, I learned that if Americans were ever going to receive comprehensive affordable care that truly protected them by lowering their premiums and risk, they would have to receive sound, unbiased counsel from somebody that knows. So I made it my mission to do just that. I never ever want another family to be caught off guard and suffer because they thought they had better coverage than they actually had, or simply couldn't get care because they couldn't afford coverage for even the most common needs. Nor did I ever want another employer to be in the position where they couldn't hire or keep a top talent over lack of quality health care. However, solutions only solve problems we are aware of, and like an approaching tornado, only those who have the insight to build a storm shelter in advance will endure it. So following are the upcoming challenges everyone, including you, will face with Obamacare, and the powerful secret solutions that the many individuals and businesses I showed you earlier discovered in what I call the 7 secrets Obamacare and the insurance companies don't want you to know. And the first thing is, the Affordable Care Act is not and was never intended to be affordable. In theory, there were some very good additions to the ACA, necessary additions to get the law favored by the public and passed. And no one understands the need for those improvements to healthcare as well as I. Additions like no restrictions for pre-existing conditions, essential health benefits must now be covered. A whole list of services, including things like mental health and maternity. Essential care that insurers previously refused to include must now be covered. Also, there are not any caps on annual lifetime benefits or individual incident benefits. The new law means that insurance companies can no longer drop the critically ill or mitigate their risk in certain procedures and pass them on to us. And of course now, insurance is included to children up to the age of 26 on their parents' policy. These are all very valuable protections for the consumer that were made as a result of the ACA. However, now, and because of these added protections, costs are bending up, not down. Just last year alone, we've seen costs rise 25 to 35%. But then again, the insurance companies already knew that because of the second thing they don't want you to know. The ACA or Obamacare was primarily enacted to increase healthcare profits. The U.S. healthcare costs in 2013 were $2.7 trillion a year, and by 2017, if not sooner, they will reach $4.5 trillion. This is according to the Kaiser Family Health Foundation, the preeminent organization for healthcare stats. And I should probably mention that all the statistics in this presentation forward were provided by Kaiser as well. Now here we have the insurance companies, Big Pharma, the American Medical Association, American Health Association, trial lawyers, and the U.S. government who all previously knew of these cost projections as early as 2012 and now as a whole stand to double their income within the remaining 18 months. In fact, actually hidden within Obamacare, the insurance companies alone are now allowed to increase their profits per policy by 4 times as much to pre-Obamacare regulations. Here's a quick question. Do you believe any of these entities hold your best interest above their own? Number 3, access to care will decrease. Does this scene look familiar to you? When you or your children are sick, are you increasingly wasting more personal time and lost work hours in the waiting room of the primary care office, MedFirst clinic, or local hospital ER? Because right now the average time spent in a primary care office or MedFirst clinic is a minimum of 2 hours, and 6 hours in a hospital ER, all to be seen by a doctor or practitioner for no more than 5 minutes. And what if someone gets sick after hours or in the middle of the night? Because other than a costly MedFirst clinic or ER, the doctor is only available for 40 hours out of a 168-hour week. Or do you just bring your illness to work and cause a chain reaction? Last year, there was a shortage of 40,000 plus primary care physicians in the U.S., and the shortage is expected to reach 65,000 by the end of this year, and as high as 130,000 by 2020. Therefore, access to doctors will require much greater wait times, probably double or triple, and actual visits with the doctor will have shorter durations. Be ready to start experiencing misdiagnosis more frequently because more care is being handled by nurse practitioners who are already trying to fill that void. On top of that, the ACA will add an estimated 30 million people to the healthcare system by the end of this year. With more people to care for and less doctors, do you see wait times getting any better or worse? The fourth thing they don't want you to know or fully understand is what you're paying for. What the cost and risk actually is for the average family of 4 with an average plan. Insurers for years have been riding the wave on the false security Americans believe they have with their healthcare coverage. The Kaiser Family Foundation lists these figures. The average premium for a family of 4 is $15,745. The average family deductible is $4,100 and increasing every year. And the average out-of-pocket after deductible is $11,900. Out-of-pocket is a co-insurance maximum share that is usually added to the deductible and increases the total money out of your pocket to $16,000 a year above what you already pay in premiums, not including the potential tens of thousands of dollars a family could be additionally liable for if they were to have an emergency with an out-of-care network care hospital, surgeon, anesthesiologist, or specialty nurse. Because out-of-network care is not capped in the new law. and the majority of those charges, if not all of them, fall to the patient. Out-of-network care is a major cost shift to us because it's impossible to pre-plan an emergency surgery or care, and while we never think about that beforehand, the insurance companies count on it. We are now well over $30,000 a year of actual cost and combined risk for a family. As it stands, the current average total health care cost per family per year is $20,728. No wonder medical bills are still the number one cause for bankruptcy among the insured. And just as alarming, 58% of all insured have actually omitted care and/or medication due to their inability to pay out of pocket for prescriptions and services. Again, even though they have insurance, they can't afford to use it. And it's just plain insanity. Especially when you factor in the sixth thing they really don't want you to know, and that is how the majority of us actually use our healthcare for that amount of upfront financial cost and continuing risk each and every year. Of all the reasons why a person goes to the doctor's office or emergency room for care, 78% are just common illnesses. 4 out of 5 times it's just things like sinus problems, urinary tract infections, bronchitis, strep throat, and the flu. Small expenses we trade for huge premiums. 20.3% of the healthcare we use is for accidents and major illnesses. However, the cost for these items is generally paid for out of pocket within the individual's or family's deductible, and only 1.7% of all the reasons we use our healthcare is above our deductible and major or catastrophic in nature. Even then, we pay a 10 to 40% share in these costs. So if we break it down and simplify it, 34.6% of all healthcare spending is mostly paid out of our pockets, regardless of having insurance. 65% is premiums. And of that 65% we pay in premiums, we only get about an 8% return on doctor's visits and prescriptions. And all the rest of our premium, about 92% of it, is handed over to the insurance company on a less than 2% chance that we will ever use even part of it. And then if we do need it for that 2% of the time, the insurance companies now want us to come up with another 10 to 40% of that cost as well out of pocket. Doesn't that sound like a smart deal to you? So why don't we see what's going on more clearly? The knowledgeable already have. In fact, the businesses and individuals that do not only end up saving about $9,400 a year per family on premiums, but actually receive better care and get 100% of the costs within this 1.7% covered. Not 60 or 90% of it covered, but 100%. They accomplish these things by ceasing to follow what the agents, brokers, and marketplaces that profit from them tell them what to do, and instead carefully craft together the healthcare program that benefits them and their main needs. And it all begins with building a great foundation by securing the coverage for that 4 out of 5 times we need it most. When you change this one thing, it shifts all the power of your coverage and costs in your favor and under your control. Because the seventh and main secret that insurers and Obamacare don't want you to know is the foundational solution. Kaiser not only says that 78% of all illnesses have been proven to be better handled this way, but with a much higher success rate. Now when someone gets sick, they just pick up the phone and call or use an app at any time from wherever they are. Request a telephone or video consult with a doctor and can even select the time for the consult. The doctor will call back together with your medical records in front of them, usually within 20 minutes or at the specified time. After diagnosis, and if necessary, the doctor will call in a prescription at the nearest 24-hour pharmacy, wherever they are in any state, where you can get it filled right then at any time, day or night, at a huge discount. The result is you get better faster. And we go a step beyond that, because we will send you a follow-up email within 24 to 48 hours to make sure all went as they should have, and even a doctor's note upon request. Imagine if you came home from work with a scratchy throat. Would you rather go to the emergency room and deal with that all night, take a home remedy and be sicker in the morning, or just pick up the phone, call our service, and within an hour or so get a prescription filled and be off to sleep and ready for work in the morning? And what if it wasn't you that were sick, but your child with a high fever in the middle of the night? It just makes sense, doesn't it? And that's why we have an astounding 97% retention rate. Those that use our service almost never give it up. I personally have seen it work wonderfully for over 24 years because my son always had a nephrologist on call 24/7 should he get even the slightest fever, and the issue was always immediately resolved for him. However, my only regret during that time is that we didn't have the same care option for my 6 girls. That is until 3 years ago, and now they too are benefiting from concierge medicine. I understand that it's a new concept to many people, but so was computers in the 80s, Google and cell phones in the 90s, and banking apps just in the last few years. Everyone I know thought twice when banking apps were introduced because of potential security issues. Yet when they can easily and conveniently access their money by phone, hardly anyone I know ever goes and wastes 20 minutes in a line at a bank anymore. Nor should they waste 6 hours waiting to spend just a few minutes with a doctor or practitioner. Or even more importantly, risk their or their child's health because of shortage of funds. Because at $19.95 a month for the entire household with no copays ever and unlimited use, everyone can afford concierge service and never ever again have to compromise their family's health. Or why would any employer want their key employees to have to take a day away from work when they could just provide them with a 10-minute call instead? Common uses are sinus problems, urinary tract infections, pink eye, bronchitis, upper respiratory infections, nasal congestion, allergies, flu, cough, and ear infection. And it's important to note that there is not any prescribing of DEA-controlled substances or medication for psychiatric illness or lifestyle drugs. If pain control is needed in the treatment, then we feel the patient should be seen in person. We have the largest telemedicine company in the world with the highest quality of care found anywhere. Because we directly manage our own network of physicians, they are all board certified, state licensed, and have a minimum of 15 years experience in all 50 states. We also realize that as valuable as this primary service is, it is stress that's responsible for most minor and major illnesses in the home and workplace. So included in our service, we provide a very valuable set of additional preventative services to help manage that stress. We provide telephonic counselors for any issue in your life, a well discount card for up to 75% off prescriptions and other services like lab tests, vision, and dental care, online work life resources, extremely in-depth, in-person counseling, resources, and guides for employers and employees on a wide range of issues from HR and employee management issues to substance abuse and more. We also provide legal and financial advisors where employers or employees can talk with attorneys or financial consultants for as long or as many times as needed, because nobody is ever very effective at work when they have a legal issue, IRS, or similar issues to deal with. And my personal favorite, which is Medical Bill Saver. Hardly anything is worse than having a loved one in need of essential care and not being able to receive it because you didn't have the deductible money up front to have them cared for, or to fight for their life while in the hospital and finally get well, only to return home and realize the battle has just begun with the astronomical 10 to 40% co-insurance and out-of-pocket bills awaiting you. Have your own expert patient advocacy team take care of the details by pre-arranging care and time to pay for it, or by reviewing and reducing your medical bills by up to 50% or more afterwards, so all you have to worry about is getting your loved one back to good health. So what happens to the cost of care and risk? If you look at the cost for that same 80-20 and you concentrate on purchasing insurance for just that 1.7% high risk and get 100% coverage $10,000 deductible plan, the premium goes down to around $63.50 a year per family. And that $10,000 deductible actually gets reduced to about $5,000 after patient advocacy. And the total cost and risk ends there, way below the national average. Now alone, that high deductible plan does not qualify for Obamacare unless you are less than 30 years old or are over 30 and qualify for an economic hardship exemption, or have to contribute more than 8% of your household income for coverage. But coupled with this telemedicine service at just $240 a year, it does. So that's about a $9,400 a year or about $780 a month savings per family. And even if you have to use that $5,000 deductible or put it in an HSA, you will still save $367 a month. Total family healthcare spending at around $11,590 per family versus the national average of $20,728 plus additional risk. Now that's how healthcare coverage should work and could work for you. But it all only works by first using our Telemedicine Plus service as the foundation in your healthcare plan. And again, this is why and how all these businesses have done just that. Lastly, saving money is great, but whether you have or want or need to change your insurance or not, I'm going to share the most compelling issue that nobody ever really knows about or even thinks about until it's too late. This is something I have personally witnessed in the hospitals throughout the last 24 years and is the greatest reason I bring all this knowledge to you. And that is, I've literally seen hundreds of children suffer from chronic heart and kidney problems. And what most people who have never had a family member go through this don't realize is the majority of these children were not born with these issues. A major portion of them actually contracted these conditions because they had what their parents thought was a simple cold that within a few days' time turned out to be a virus or strep that settled into an organ and completely destroyed it forever, and left them where numerous surgeries, dialysis, heart machines, and or transplants were their only saviors. Lifelong illnesses that nobody ever wants to live through. And I'm sure we've all heard of how bacteria and minor abrasions and cuts that can easily be handled through our service result in the similar catastrophic conditions with loss of limbs or life when not treated with antibiotics immediately. Or have a stubborn person like me who had a heart attack several years ago and was minutes from losing my life because I waited for hours to get help thinking I had heartburn and didn't know that the pain in my jaw was a classic sign of a major heart attack. Yet each of these situations could have been averted and or identified much sooner had we had immediate access to a doctor when it started. I do this mostly because I never want to see a child suffer or a family destroyed because they didn't have that simple, immediate, and affordable access to a medical doctor without a copay. These are things nobody ever regrets until it's too late, so do it today. At $19.95 a month for the entire household without any copays ever, we can all afford the right choice. Total peace of mind that your whole family is protected for the majority of reasons you will need a doctor this year for less than one soda or cup of coffee at just 67 cents a day. $19.95 a month to save you $200, $500, or even $800 a month on your insurance premium when you make it the foundation of your total health care plan. So the only real cost is in not doing it. For all individuals and families, just click the link below and then scroll down and click Plans and Pricing and then click Enroll Today. Or call the person below. For all employers, please contact us via email or phone and we may be able to arrange a reduced amount per employee for further value to your business. Congratulations, and we look forward to hearing from and serving you.